Hi everyone, my name is Jawaria Chaudhry, preferred name Jerry, and today I'll be presenting my final project proposal for Computer Foundations for Health Informatics. The topic I've chosen for my project is mental health and substance use. This is an area I feel deeply connected to both professionally and personally. As a pharmacy and bioinformatics student, I've seen how data can shape healthcare outcomes, and I'm passionate about using technology and analytics to support mental health awareness and improve care delivery. I chose this topic because mental health and substance use remain two of the most pressing public health issues today. Across the United States, we continue to see rising rates of anxiety, depression, and addiction, especially following the pandemic. Yet despite increased awareness, there are still major gaps in access to care, early intervention, and equitable treatment. I also chose this topic because I've seen firsthand how mental health challenges can affect individuals' lives and academic or professional paths. My own encounters with stress and mental health have taught me the importance of seeking help early and creating systems that make support accessible and stigma-free. Growing up, I moved a lot and learned to adapt to different communities and healthcare systems. That experience taught me how uneven mental health support can be depending on where you live, your income, or your background. So this project feels not only meaningful but necessary. It's a way to use data to tell a story that can drive real change. The main objective of my analysis is to explore how health informatic tools, specifically Excel-based data analysis, can be used to identify patterns and disparities in mental health and substance use outcomes. I'll use skills from this course such as creating charts, pivot tables, data validation, and what-if analysis to visualize how different social determinants of health like income, education, housing can correlate with mental health crises and substance use trends. Ultimately, my goal is to demonstrate how data can guide decisions in healthcare policy and resource allocation, ensuring that those who need care most are not overlooked. Some of the key questions I aim to answer include: what demographic or socioeconomic factors are most associated with high rates of mental illness or substance use disorders? Are there regional differences in access to mental health treatment or recovery services? How do coexisting challenges like unemployment, housing instability, or lack of transportation affect relapse or hospital readmission rates? And finally, how can visual tools like dashboards or pivot charts make these insights more accessible to healthcare leaders and policymakers? These questions, they will guide my data exploration and shape the visualizations I create throughout the course. The impact I hope to have with this project is to highlight the need for integrated, data-informed behavioral health systems. Too often, mental health care operates separately from primary care. That separation leads to fragmentation, poor communication between providers, and patients slipping through the cracks. Through my analysis, I hope to emphasize how informatics can strengthen coordination by identifying at-risk populations earlier, supporting preventative interventions. My findings could inform evidence-based recommendations that promote equitable access and reduce stigma around seeking help. In this project, I'll use Excel to organize and visualize real-world data sets related to mental health and substance use. I plan to use functions like pivot tables, trend lines, and what-if scenarios to analyze the data trends, identify correlations, and present clear, meaningful visuals. I also want to focus on accessibility, making the data understandable not just to analysts, but to public health professionals and community leaders who can act on it. My goal is to translate raw numbers into actionable insights. Several agencies are already working tirelessly in this area, such as the Substance Abuse and Mental Health Services Administration, the National Alliance on Mental Illness, the Centers for Disease Control and Prevention, CDC, and the National Institute on Drug Abuse. As for data sets, I plan to use publicly available sources such as SAMHSA's National Surveys on Drug Use and Health, the CDC's Behavioral Risk Factor Surveillance System, and community-level data from county health rankings and roadmaps. These data sets will allow me to analyze national and regional patterns, then I can clean and visualize that data using Excel as I progress through each module. In conclusion, this project is an opportunity to connect my academic learning with the topic that truly matters. By applying informatics tools to mental health and substance use data, I hope to show how technology can humanize healthcare by turning data into compassion, insight, and better outcomes. Thank you for listening, and I look forward to sharing my findings as the project develops.